The following program is the work of broadcast students from the British Columbia Institute of Technology. BCIT Magazine features news stories from around the Lower Mainland over the past week. Responsibility for the content of the show rests completely with the students and their BCIT instructors.
Coming up on BCIT Magazine, the Green Party rallies to get their voice heard.
And nurses protest against a lack of hospital space. Hi, and welcome to BCIT Magazine. I'm Ellie Shortt.
And I'm Christa Dao. Well, she didn't go down without a fight. Earlier this week, Green Party leader Elizabeth May held a rally in hopes of getting her voice heard, even if that meant she needed a little help from an environmentally friendly microphone. My co-anchor Ellie Shortt was at the Vancouver protest and has this story.
It may look like he's going nowhere fast, but this cyclist is trying to get voices heard, not cover distance.
It's a DC motor running backwards, so it puts out power instead of taking in power.
It's a green way of getting voices heard at a rally protesting the decision to not involve Green Party leader Elizabeth May in the televised federal election debates.
I'm very grateful to our bicycle-powered microphone because, as you can tell, this fresh, new voice is not sounding so very fresh or so very new.
Even though her vocal cords were a little worse for wear, the message was loud and clear.
So I'm afraid I'm not impressed with the other leaders' commitment to democracy. I'm not impressed with the consortium's willingness to be capricious and arbitrary in their decision making.
In the 2008 election, the Green Party garnered almost 1 million votes and has gained significant support since. So why then is Elizabeth May not included in televised debate? Well, the networks involved say it's because the Green Party doesn't hold a seat in Parliament.
But May and her supporters feel that it's not just about seats, but more so an undemocratic decision that serves the interests of the broadcasters involved and not that of the Canadian people.
Here we have a consortium of broadcasters deciding how elections should be run, right? Or how election debates should be run. It's very, very undemocratic.
This decision by the consortium is against the public interest. It actually leaves Canadians who are not engaged even less engaged. The largest proportion of the Canadian public that supports the Green Party are young. And this decision, of course, will further disengage young people from the political process.
With all the support from Canadians young and old, perhaps May will get a chance to have her voice heard after all. And who knows, maybe they'll even let her bring along her bike-powered mic. Ellie Shortt in Vancouver for BCIT Magazine. Now, unfortunately, all her efforts didn't secure Elizabeth May a last-minute spot in the debates, but the country did get to watch Stephen Harper, Michael Ignatieff, Jack Layton, and Gilles Duceppe hash it out, if you will, on the televised broadcast. BCIT's Keanan Kipp has been following this story. Keanan, what can you tell us about last week's showdown?
Well, Ellie, there's been lots of speculation about who actually won the debates and even talk about changes in popularity for many of the candidates. But one thing that has definitely increased is the popularity of the debates themselves. Now, following Tuesday's English debate, there was reportedly 38,000 debate-related tweets flying around the Twitterverse, including topics like Gilles Duceppe, Iggy, and even Stephen Harper's robotic appearance. And this Twitter frenzy was just increased when Jack Layton tried to appeal to the younger population by saying that a lack of youth diversion programs was a hashtag fail. Now, for those of you who are unaware, a hashtag is the use of a number sign to group similar posts on Twitter.
Now, I did mention how Green Party leader Elizabeth May wasn't involved in the broadcast. Can you tell us a little more about her role in all this and how she managed to get her voice heard despite being excluded from these debates?
While May wasn't actually allowed to participate in the televised debates, she did take full advantage of social media sites. She blogged, she tweeted, and she even broadcast a live video chat, including her commentary and her opinion on some of the discussion topics. And in an unofficial count, they said that almost 36,000 people tuned into that webcast. Back to you in the studio.
Thanks, Keanan. Well, you usually find them in wards or in emergency rooms, but not this time. BC nurses took to the streets in New Westminster to demand an increase in healthcare funding. I took a visit down to Royal Columbian Hospital to see what exactly was making their blood boil. BC nurses are used to this kind of scene, overcrowding, and that's exactly the message they want to send to the government.
All levels of government to step up and start funding, and we need a publicly funded, universally accessible healthcare system. You hear oftentimes that our healthcare system is not sustainable. Well, we cannot afford not to sustain it.
All federal election candidates of the New Westminster Coquitlam riding were invited to attend the rally, but only one showed up.
Those seeking treatment at Royal Columbian Hospital, this hospital right behind me, would say that we have failed that test. Patients were treated in a Tim Hortons. A day later, I stood up in the House of Commons on the floor and asked the Minister of Health to order a double-double on the double and smell the healthcare crisis in this country. These attacks on our healthcare system are more insidious because they are unnecessary.
And nurses say that the attack on healthcare is also an attack on patients themselves.
Well, I think if you have a patient in the hallway, they don't have suction, they don't have oxygen, their cords are running across the hallway wherever there's a plug-in, so there's no privacy. It's like being put out on the street, really, when you think about it. Oh, they put a little curtain around you. Sometimes they don't even do that, and everybody walks by you. So if you're sick and you're out there, how is that quality care? Where is their dignity? You know, you have no dignity in the hallway.
Some of the nurses that I spoke with here at Royal Columbian Hospital say that the issue of overcrowding, well, it's always been an issue, and that's exactly the point. They say that if it weren't for the Tim Hortons fiasco a couple of months ago, healthcare would continue to be on the back burner. They want the government to wake up and smell the coffee, and they say double dipping is no longer an option. Christa Dao in New Westminster for BCIT Magazine.
A BC judge has concluded a law stripping teachers of the right to negotiate class size and composition during contract talks is unconstitutional. Justice Susan Griffin ruled the legislation violated the collective bargaining rights of teachers when it was introduced in 2002. She has suspended parts of the legislation and given the province a year to address the issue.